Welcome back to Life with the Spectrum. I'm Gina Cavalli, and the more I read up on social media and different platforms that I belong to, the more I see parents' concerns about, first getting their diagnosis, which I've been there, done that, feeding and eating habits and pica and safety and elopement issues, constipation, IEPs, you know, and then it's so sad because I see as I'm reading that they just don't have the resources. So how do you get those resources? I got you. Dr. Kristen Stoll is the executive director of Echo Autism, and they've got the 100-day kit for newly diagnosed families, and they've got a little something for everybody. Please welcome to the show, Dr. Kristen Stoll. Hi, Dr. Kristen. How you doing?
I'm doing great. Good to see you.
Nice to see you, too. Thanks for being on the show. Now, I want you to tell viewers what Echo Autism is and how long has it been around?
Sure. So Echo Autism is a professional development platform that really helps to bring autism best practices to rural and underserved communities. And so really the goal here is we know that wait times are huge all over the country, really all over the world, for everything from diagnosis to treatment to school services. And so Echo Autism is all about bridging the gap between specialists and in usually urban academic centers and people who live in rural and underserved communities across our country and the world. We started in 2015.
Right.
First with primary care clinicians, and we have since expanded and are now global. So it's been a really great 9 years.
Oh my gosh, what a great run. It's so funny because when I read, I don't know if you belong to all of these different social media platforms like Autism Moms, Autism Special Support Groups, different things like that. The wait times are always what people are talking about. Like, it's 6 months, it's 8 months, it's 4 months. I'm like, oh my gosh, I feel so bad. Because I was there too when the wait times weren't as bad, but it was still 2 or 3 months before we could start getting like ABA services and things like that.
Exactly. And imagine, I'm not a parent of an autistic person, but I can imagine if somebody said to me that, hey, there might be something going on and it's going to take you anywhere from 3 to 12 months to get an answer. I just, honestly, like that's just unacceptable to me. And so even though I am a diagnostician, I am a person who, serves many, many people on the spectrum, and have a wait list, right? So like that's an issue. And yet I just couldn't sit by and continue doing the same thing we'd always done, which is just say, well, yep, that's what it is, right? Like that's what it is. And you'll have to just wait in the queue like everybody else. And while I understand that that still happens, and I know that that will likely continue to happen for a long time, I wanted people to have access to professionals who are equipped to serve their child or themselves right in their own local communities. And so that's what Echo Autism is all about.
So let's talk about that learning loop. Like for families, how does that work? Like say, for instance, I am out in East Bum, you know where, and what happens with this learning loop? How can people get involved with that?
Yeah, great question. So it's really mostly for professionals. So it's not a direct to consumer, meaning we don't see patients over telehealth or via Zoom, but we're really working to build skills in everything from doctors to teachers to therapists, et cetera. So that learning loop happens when a specialist like myself is working hand in hand with a generalist, let's say, and it's a big learning community. So we might have 25 primary care physicians and practitioners, so pediatricians, nurse practitioners, things like that, who are all learning from a team of experts in real time. So we're all working together, usually about twice a month, and we're listening to each other discuss cases, discuss different issues that might be going on for a particular person in their clinic. It's always de-identified. So we're usually saying things like, this case is a 10-year-old with autism and constipation and behavior issues, whatever, what should I do kind of thing. But it's partnering specialists. So again, I'm a specialist in developmental behavioral pediatrics. And then we also have a clinical psychologist, a child and adolescent psychiatrist, a dietitian, a social worker. And we're all working together to skill up the generalists so that they can provide access to those best practices in their own clinic. So where it intersects with families is that if you're a parent and maybe you're going to your pediatrician for, let's say, constipation. And the pediatrician's like, yeah, I don't really know how to manage constipation and autism. And you're like, okay. And spoiler alert, it's the same. Autism and constipation is the same as not autism and constipation. But the point is, though, sometimes it is the general pediatrician may not have the skills that they think they need. And so Echo is all about saying, but you do. Let us teach you how. Let us teach you how to demystify autism so that it's no longer kind of, mysterious to you, because it's not mysterious. It's pretty straightforward. And yet there are very little training that happen in our residencies.
I'm so glad that you just brought that up, because one thing that I've been reading on these social platforms, and a big thing, not just the wait times, but also about the fact that they take their child to a pediatrician and they're like, these are some of the things that we're experiencing. And the general physician just kind of looks at him like a deer in a headlights, like, I'm not too sure what to tell you. And then they can't even recommend like the next steps. And I see the mom's frustrations, and moms are just like, I'm over here bawling. Like, what do I do? I'm so happy to know that Echo Autism, I'm going to start plugging you on all of these socials, because I mean, I see it day after day, and I'm trying to plug myself. I'm like, oh my gosh, these poor moms, these poor dads. So to know, Now, do the physicians meet virtually then you have these virtual meetings?
Yeah, so it's always virtual. And what makes that awesome is that it makes it very accessible then. You don't have to leave your practice. You don't have to leave your family. You don't have to travel. It's free. And so anyone professionally can join and learn. And so I think it's important for parents and frankly everyone to recognize that our current system of training pediatricians, and this is similar for family physicians and nurse practitioners, but I know pediatrics best, is very inadequate, right? So they only get 4 weeks out of a 3-year residency in any kind of development. So that is not a lot of time. And so it's honestly not surprising that the pediatrician is not quite sure what to say when the parent brings those questions. Now, I'm not one to sit on my haunches and think that that's an acceptable response, because as a pediatrician, I'm really passionate about the pediatrician's role in serving their patients. And so while I understand 4 weeks is not enough, and it gives you a lot of, you're stressed out when you don't have enough knowledge to answer your patient's questions. That's what we try to do in Echo Autism, is to say, you know what, it's okay that you don't know. We will help you learn how to know, so that mom doesn't have to be scared and crying in your office. And you also, as a professional, don't have to be, frankly, scared and not sure what to say back to that mom. And so we really work through those next steps, everything from, okay, it sounds like you've identified a concern, mom, about your child's development. Here's what we're going to do next. 1, 2, 3, right? Or, all right, your child has an autism diagnosis, is on the spectrum. Here's what we need to do next. 1, 2, 3. Or your child's now 15 and they're going to graduate high school, and you're not sure whether they should go on, and go into the workforce or go into secondary education. All right, let's talk through that. Let's talk through what are the next steps for transition for your child, right? So it's really about empowering those professionals, particularly physicians, but we have programs for early intervention therapists, mental health clinicians, psychiatrists, you name it, because frankly, very many families have that same experience you just described, where they're staring at their doctor like, help me. And their doctor's like, I'm not sure what to tell you. And so we want to stop that. We want families to, no matter where they are, they have access to a professional who is equipped. And if they're not sure, they have a fallback in a specialty team like Echo Autism to ask those questions and say, here's what this mom asked me. I don't know what to say. Right? Or here's what this child asked me. I don't know what to say. And so as a team, we can bridge those gaps.
With me today, Dr. Kristen Sohl, the Executive Director of Echo Autism. When we get back, we're going to find out how you can start your own Echo. Stay with me.
Hi, I'm Brad Grzelka, owner of Atlanta Swim Academy.
You really don't have a program like this anywhere else.
Very passionate about water safety and providing the best swimming lessons possible in East Cobb.
Make it all fun and get them comfortable with the water.
We are
Atlanta
Swim Academy.
Atlanta Swim Academy.
Atlanta Swim Academy.
Woo!
We are Atlanta Swim Academy.
Welcome back to Life with the Spectrum. I'm your host, Gina Cavalli. With me today, Dr. Kristen Sohl. Very busy, because in addition to being the Executive Director of Echo Autism, you have your own practice that you're dealing with. So thank you very much for taking some time out of your day for me. Tell people how they can start their own Echo and what that is all about.
Yeah, so Echo is an amazing global platform that's actually been used in numerous different, medical conditions as well as education. It's all about moving knowledge, not people. So if you happen to be listening and maybe you run a school for autistic people, or maybe you are a researcher or a clinician or what have you, and you're like, you know what, I have a lot of knowledge that I need to get out there so that more people have access to it. Echo is a great way to do that. Echo is a no-cost platform. My team at Echo Autism actually trains a lot of other specialists in how to use the Echo model so that they can have that same impact across their own regions. So for example, we have a lot of Echo Autism programs here in Missouri, which is where I live, but we actually have Echo Autism in about 60 different locations across the United States, as well as 30 countries. So yes, we've been very busy with that whole concept of how can we move knowledge, not people? How do we get people, wherever they live in this world, the knowledge of best practice autism supports and services, diagnosis, etc., what they need, when and where they need it. And so Echo Autism is an amplifier. It really takes the expertise that many of us have inside our minds, inside of our clinics, and says, okay, I have a wait list, or I can't get as many people into my services as I need to, but I don't have to stop there. I don't have to accept that kind of limiting belief. And I can say, well, yes, I am going to continue to provide those services myself and have a wait list to see me. But while I'm doing that, I'm also going to extend my knowledge to people in my community, whether that's regionally, internationally, what have you, so that I'm doing more than just the piece in my brick and mortar building.
And I know you are traveling, you're going to these different countries, you're getting the word out there. What do you see on the horizon? Just from 37,000 feet, since you're up there quite a bit, what do you see on the horizon? What's your take on global issues around autism? What are you kind of seeing in different countries that you're bringing back right here to the USA?
Yeah. So, honestly, I see the most beautiful part of what I get to do is see autism in so many cultures and see that same commitment, passion that parents, caregivers bring to autism, as well as really the uprising, the positive uprising of autistic individuals, really advocating for themselves. So I see so much in our neurodiversity movement and inclusive of the disability movement, really thinking about saying, disability is a huge piece of diversity, equity, and inclusion. And so when I look globally, I see a much improving landscape related to the inclusion of people with disabilities, scientifically speaking, if you will. And I know there's a lot of debate over autism and disabilities versus neurodivergence, et cetera, et cetera. But the bottom line is the sheer fact that we're even able to have a global conversation about neurodivergence is actually amazing. And so when I'm kind of traveling, I get to see not only the fact that so many places are dealing with the exact same issues, access issues, supports and services issues, advocacy issues.
Wait list issues.
Exactly. What I see is that there is a global community, frankly, who are all experiencing fairly similar situations, who all are very committed to making it better and making the voices of autistic people very relevant and very important in both policy as well as community inclusion. And so that's a really exciting thing for me to be able to see. And then also just to remind myself that I'm not alone, right? Like I'm not the only clinician out there trying to increase access to best practices. I'm not the only one, trying to think about how do I help serve that child who's on, this small community or what have you. And so it's really encouraging to see that global passion around neurodiversity, particularly related to autism.
There are more good people than not, right?
Yes.
There are more people like you out there being a force for good. How can people find you, Dr. Kristen?
Absolutely. So I would love for anyone to connect. We have echoautism.org as our main website, but we're also on all the social media platforms. So you can absolutely find us on Twitter or X, on Insta, as well as Facebook at Echo Autism.
Thank you so much for being on the show. What great information you put out there, and a great way of looping it for everyone, families and doctors too. Thank you so much, Dr. Kristen.
Thank you so much. My pleasure.
Echo Autism, it isn't just for parents, it isn't just for physicians, it's for communities of people, especially in rural communities where you might not be seeing the right doctor at the right time for the right diagnoses, right? And if you need to get those tools and resources that I mentioned in the beginning of the show for pica, feeding, safety, elopement, constipation, behavioral, IEP, echoautism.org is a great place to start. And of course, for general physicians, learning from those experts in their field just makes them more knowledgeable and can help the patients themselves, right? I know it's like a no-brainer. Thanks so much for taking the time out each and every week to come back and watch or listen to Life with the Spectrum. It's available as a podcast wherever you grab your podcasts, of course, right here on YouTube, where you can grab the latest episode each and every Sunday. We launch them live at 6:30, so we appreciate you checking in. And if there's somebody in your neighborhood that's making a difference in the world of autism or special needs, I want to know who they are. Maybe we can book them for a future episode. You can comment with their name below and contact information, or you can always reach out to me at gcast.com. That's GKASTS.com. Till next week, we live life with the spectrum. See ya. Bye.